says English right now, but if you click on it, it could say off English or French, and then you would put it into your preferred language. There are going to be some PowerPoint presentations a little later on, so just so that you know, those are all going to be on the NAFC website, and there's going to be links posted in the chat. So that's my housekeeping. So now we're going to start our forum in a good way. And I'm just so thrilled that grandmother Irene is here to provide the opening today. Somebody who I've had the good fortune of knowing for a couple of decades now, always just so warm and kind, and somebody who I very much look up to and admire. So Grandma Irene, I'll turn that over to you now to start this meeting off in a good way.
Thank you. Good morning, everybody. My name is Grandma Irene Lindsay. I was born in Lanaudiére, Saskatchewan, and I went to the residential school for 8 years in Duck Lake, Saskatchewan. I'm a mother of 6, grandmother of 9, 7 grandchildren, and 4 great-grandchildren. My spirit name is Eagle Eye Woman. I'm from the Wolf Clan from the Cree Nation. It's always an honor to be here, to be able to pass on a few little spiritual things to everybody. And it keeps you grounded like that. That's where I find it better. When something happens, put my smudge bowl and away we go. You know, but these are the things sometimes we don't have time to do in your busy time anyway. So we ask the Creator today to guide us through the things that we need to talk about that are very important, and especially to do with our children. And these are the things that I go for when it has to do with something with children. Just get me there and I'll be there, you know. And it's very important that we give everything to our children as they grow up. And these are the things that are going to keep them strong. And remember what we teach them. I didn't have that. I didn't have that when I was growing up. I was just very lucky that I met up with Lillian Adwanaput, and we worked together. My goodness, her and I worked together so neat, and she taught me so many things. And this is the reason where I am here today. And I appreciate this because I've always liked helping people, you know, with organizations, about doing things like that. So we asked the Creator also to look after our elders today, the ones that are sick. Let us hope somebody's looking after them there. And also our little ones, the ones that are on the street, those that are cold and hungry and need shelter. Let us ask the Creator to bring those little ones towards us so we can give them a better life, a better way of living. So we ask the Creator to remember our sisters in spirit who died in violence. Let us pray for their families that are agonizing over a loved one today. And also our people that are dying of AIDS. May they have a loved one there as they pass on the Creator's kingdom when there's only love and peace there for them. And remember our the people that lost their families in this epidemic. This is very, very hard on some people. When you think about how many people have gone, you could almost think you can go and stand outside there and you can hear the aches and the pains and the crying of all the people that has went by. When you think about it, it's humongous. You know, that happens. And it's hard to think that, you know, that we can go bypass this, something as strong as this. But the main important is that we pray together, we stay together, and we stay safe. I'm here with my grandson, and I was going to go out and have a birthday party it was my birthday, and my 2 other daughters were going to take me out And my grandson says, no, you're not taking Grandma out. You can take her out next time when everything is cleared up a little bit, when everything is safe, then you can take her out. He says, I'm keeping her, safe here, he says. And he's so neat. And I thought to myself, no, my goodness, that's what I called caring. It's my grandson, so he cares so much about me that he would do that, tell my kids, you stay away from Mom, I'm going to keep her here. So these are the things that I find that people are feeling today. The things that the people have lost somebody in their family. It's just hard to figure out it's so humongous for me to figure it out that there's not enough time and enough prayers to go around. But it does go around. When everybody prays, the Creator just sends it all over the place. So let us remember these people and put your tobacco down for them every now and then when you think about it, just to take that pain away. So we ask the Creator to have a good day today and have a good afternoon together. Let's see. Good.
Nanescomitin, Grandmother Irene, for that beautiful prayer, for reminding us about why we gather, why we come together, the importance of the grandchildren, like how we learn together with our elders, teachers, our ceremony siblings, and also the importance of our families and how we share information across generations, and also just how we come together during difficult times and to honor loss and to grieve together. Auntie, I'm really honored to be here with you today. So Tansy, everyone, my name's Janet Smiley. I'm a Métis Cree half-breed from the prairies with Red River roots along maternal kin line. Smiley's came from County Down, Ireland. I'm a family doctor now for a couple of decades. Grandma Irene knew me when I was a baby doctor. We used to call me Doogie Hauser's half-breed sister. But now I've got some gray hair. And I am fierce and passionate about addressing racism in healthcare. I love community, First Nations, Inuit, Métis community, the Friendship Center movement, have been part of that movement. So honored today to see if I can guide us through these. This is probably my first time actually being an MC, so we'll see how I do. Just a little bit of background then about the forum before I pass it on to the amazing Jocelyn Formsma, who's going to give us a summary of the first webinar. So this forum is a follow-up to a first webinar that was held in the fall by the National Association of Friendship Centers. And it was about laying the foundation, highlighting the problem of systemic and institutional anti-Indigenous racism in healthcare. In my home office, many of us are working from our home office. I've been inspired to put up a quote actually by a relative of ours, Dr. Martin Luther King. And he says, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. Things have changed over time. So we're now seeing that people are recognizing this for Indigenous people. Unfortunately, I always say there's many flavors of racism, different kinds, unfortunately more than all the flavors of ice cream I used to think about at Baskin-Robbins when I was little. But yeah, we continue to experience anti-Indigenous racism on a regular basis, even for myself as a physician, a senior doctor. My own wife actually was subject to like life-threatening racism during critical illness in the last 6 months. During these times of COVID, it's even more challenging. So we are hoping today, we had a very successful first forum with over 500 participants. Already there's 179 people who are coming to talk about racism It's important, maybe more important than ever, to continue these discussions during this third wave of COVID, because we hear daily terrible stories of our people who unfortunately are in the hospital more often than non-Indigenous people with COVID. So today, what we're going to do is highlight the different Friendship Center programs and services and other resources that are currently available to Indigenous people to help you when you're trying to access healthcare, and make sure you have supports, because we need to kind of be there and witness and support each other in these hospital settings, because it's actually the exception when we go through the hospital and don't encounter anti-Indigenous racism versus the exception being experiencing racism. The part B is actually going to be on knowing your rights. So we're really lucky that we have some Indigenous legal experts here that are going to help us with knowing our rights. Before I take up too much extra time, luckily I've been so busy trying to vaccinate people who want vaccination for COVID, I didn't have time to come up with a whole bunch of corny jokes. It's going to be my pleasure and privilege to introduce Jocelyn Formsma, the Executive Director of the Indigenous Friendship Centers, and she's going to give us an update on what's happened to date. Jocelyn told a nice story. We were on another meeting, I think. So I just met Jocelyn. I may have met her in passing prior to COVID, but over a year ago now, I think it would have just been the last or second last week of March. I reached out to all the different community organizations I was working with, and I said, what can I do to help? And Jocelyn called me back. And I've had an opportunity to work with her over the last year and admire her work as well, and just see her leadership during these challenging times of COVID. So I have a whole bunch of respect for Jocelyn. In addition to being the Executive Director of the NAFC, she's a member of the Moose Cree Nation in Northern Ontario. She has an Honours Bachelor of Social Science and a Juris Doctorate from the University of Ottawa. And already over 19 years of work and volunteer experience. So she is called to the Bar of Ontario, has worked as a lawyer for a First Nations owned firm, and worked for numerous national Aboriginal organizations and First organizations. And if that wasn't enough, being a lawyer, working for all these national organizations, she actually has a media background as well. So she's the chairperson of Aboriginal People's Television Network board member. And there's many, many other things about Jocelyn. She actually was an Indigenous youth, I think, in the Friendship Center movement, and this is clear. So she brings her legal training and passion to her work. But what I also just love about working with Jocelyn are her values and her voice and her commitment to the people. So Jocelyn, I will call on you now to share a little bit about what's happened since the last forum.
Thank you so much, Janet. Wache Niswe, Shwe Banish, Nishnakasun. My name is Jocelyn Formsma, and as mentioned, I'm the Executive Director of the National Association of Friendship Centers, and it's our pleasure to present this forum today. I think first of all, what I would like to say is Chimigwech to everybody who is here today, spending time with us. Things are really busy. There's a lot of different ways that we could be spending our time. And so we really appreciate that you were taking the time today to participate and to listen, to learn, but also contribute. Last time I was blown away by the just robust and rich conversation that we had in the chat. It was almost like two forums were going on at the same time, and people were responding and asking questions and sharing their experiences and talking about what's happening in their communities and what needs to be done. And I thought that was almost as great as the presenters that we had at our forum. So I encourage you all to do it again and share in English or in French. Either way, your words and your stories really help to make this forum a success. Because what we were trying to do I remember getting a call from the executive director at the Lanaudiére Friendship Center in Joliet, Quebec, Jennifer Brazo, who you will be hearing from, and her telling me about the loss of a community member the day before, and just sharing that moment about like, this has to stop happening. We have had enough. And in this instance, that we had a recording of it, and the racism was so blatant, it was just dripping out of the people that were hired and were supposed to help, the people that we were supposed to trust the most, people that were there to provide us with help in the time of need, not only utterly failed, but just had the most indignity and disrespect, as someone was losing their life. And it really affected us all. It hit us in our gut, it hit us in our core, and it was the moment where we're beyond any other circumstance. We just said we have to do something. And it was one of those moments where you kind of look around going, who's reacting to this, who's responding to this, and all of a sudden you kind of look at, well, I guess I'm someone, I guess we are somebody's. What is it that we can do? And so we held the first forum to share the stories of what happens within the urban spaces. And that's not to discount or silence anybody else's voice, but just to make sure that we're hearing from everyone, that everyone who feels like they have something to say, story to share, an idea to share, have the ability to. And so we plan on continuing these forums as much as we feel like people want to participate. And we want to encourage anybody who has a story that they feel like they're comfortable sharing, that they have the ability to bring that forward. So we started out with the basic premise that racism exists. There, like, we weren't even going to question it. We weren't even going to bring forward the stories that we have heard from the community level. We just said it exists and we need to do something about it. And so we also said, well, we know that the work is happening on the ground. I know that from my work with friendship centers. I know that from the people that that I'm family with, that I'm friends with, that there's work happening. So how do we ensure that those voices and those examples are amplified? And most importantly, how do we move forward? How do we take those examples and spread them everywhere like seeds? How do we share the knowledge, share the inspiration, and share some positive light? You know, every day can be hard and we can go in and fight the fight, but every now and then we can come together and we can talk about the good things that we're doing, the things that we're trying, and maybe learn some new ways of how to do things a little bit better. So that was our first forum. We had an amazing group. And we heard from Senator Boyer, a Métis doctor, lawyer, or sorry, Métis nurse and lawyer, who's been working in health for a long time, and reminded us that this is not a new struggle, that this is a struggle that we've had for a very long time, and that a lot of our roots in Canada come from racism and come from oppression. And so when we're thinking through our strategies, we have to think through systemically. And there are specific ways that we can utilize the Canadian government system, the Canadian legal system, to address some of those harms. It's not the only way, and it may or may not be the best way, but it is a way that we can use. We had the incredible Jennifer Brazo, executive director for the Lanaudiére Friendship Center in Joliet, who I had that conversation with, and talked about what it was like on that day and what it was like trying to get supports and the call out for assistance and help and who answered those calls, and talked about what she was going to do about it. And we brought her back today to tell us about what has happened since. We had the amazing Edith Cloutier, who is the secretary on the NAFC's board of directors, also the longtime executive director of the Val d'Or Friendship Center in Val d'Or, Quebec, and how 10 years ago their community members and their elders had the foresight to create a clinic operating out of the Friendship Center to ensure that there was culturally safer supports, to ensure that Indigenous people, First Nations, Métis, largely in Val d'Or, and Inuit had control over their own health services, and what has that meant for the residents and community members in Val d'Or. We had Dr. Alika Lafontaine, a Métis physician, talking about the ways in which the physicians and medical practitioners are taught, and how that feeds into the racism that we experience, whether it is known or unknown, by those practitioners. And the work that he's done on developing Safe Spaces, which is an online app that provides a mechanism for our people to report in a safe way. And we will hear from Leslie Varley, the executive director of BC Association of Friendship Centers, about rolling out the safe spaces amongst the region of BC, and the ideas that eventually we'll get to a national rollout of this initiative. And then finally, we heard from our very own MC here, Dr. Janet Smiley, about the strength and the amazing examples of Indigenous-led health initiatives, and the power that lies in us taking control over our own health systems. And I'm sure she'll be happy to share a bit more about the work that she's been doing. Dr. Janet Smiley is taking time out today from vaccinating our people in Toronto. And she's been instrumental in working with the community in Toronto to, one, first of all, make sure that there was Indigenous-led vaccine rollout, let alone before that, the pandemic support. And we just really appreciate you taking the time today for this discussion. So today, we want to keep the conversation going. We want to inspire some ideas by sharing more examples of the ways in which we've seen urban Indigenous people responding to racism in healthcare. We've got some incredible speakers lined up. So happen to all be Indigenous women too. That was not on purpose, but I think it just goes to show, if I can dare say, who is leading this work on the ground. And many of them are members of the NAFC and part of the Friendship Center movement, and we couldn't be prouder to share their work and amplify the voices of the community members that they serve. So let's keep the conversation going. Again, please feel free to share your responses and your reflections in the chat. And yeah, let's just keep, chipping away at the darkness till we see the light, and where we see others doing a wonderful job, let's uphold those people and just celebrate the things that they're doing. And so I will hand it back to our MC, Miigwech, to you for your sharing.
And Escomatin, thank you, Jocelyn. And thanks again for your leadership and the leadership of the NAFC to bring us all together to talk about these very challenging issues. I think that when one experiences racism and one feels isolated and alone, that's a terrible thing when one is ill already. And for sure, one of the things we can do is come together and help each other, support each other. We're going to hear other ideas as well. I see already, just for us to be getting together in these kind of forums and speaking about things. So just we have our first question coming up in the chat. Wache, everyone, I work at Native Montreal, and just recently received a call from a Cree community member who wanted to address the situation of mistreatment of her relative at a Montreal hospital. Are there any resources to help? besides communicating with the hospital ombudsman, any Indigenous ombudsmen. So often as an Indigenous physician, I'll hear these kinds of questions or concerns. I think that one of the problems is, yeah, it's very difficult to have to bridge an interface with non-Indigenous institutions and individuals. One of the things that I sometimes do, because I've worked in the hospital system for a long time, is there can be select allies. I'm really grateful here in Toronto, there's a network of Indigenous care providers, midwives, Indigenous nurses, and physicians, but I'm not sure if anybody knows in Montreal, having Indigenous leaders take it right up to the hospital CEO and the VP of the hospital or the hospital board. I know here in Toronto, we actually are working on having an Indigenous patient advocate at arm's length and outside of the hospital, and we've brainstormed. But yeah, please, if anybody else has any thoughts or advice for the person that asked this question, it was Maureen Newhook. Yeah, let me know. So my next job is to introduce the amazing Jennifer Brazeau, and she is going to give us an update. One of the things that just amazed me, and again, the response of community, the response of Jennifer and setting up a health center. So Jennifer is the executive director of the Centre d'Amitié Autochtone de Lanaudiére, and she's been president of the board of directors of Montreal Autochtone for the past 5 years. So maybe she might even have an idea to help with this situation at the Montreal Hospital. She's also a former president of Syndicat des Femmes Autochtones du Québec and a former youth coordinator with Femmes Autochtones du Québec. And she's worked to promote nonviolence, justice, equal rights, and health for women through her previous role as bullying prevention coordinator with Femmes Autochtones de Québec. And she's here today just to give us an update on the responses that she's been involved with as we've responded to the tragic death of Joyce Echaquan when she was critically ill, and also all of the other racism that is being experienced by our people when they're in the hospital. So Jennifer, I will turn it over to you now.
First, I want to start by thanking you for inviting me to speak again at the panel. And I want to thank the NAFC too for being there during the crisis that we were going through here in Joliette. A little bit like Jocelyn said, she took my call, and having a network that's so willing to be able to come together to work on an issue and to keep this really in the front as a priority to be continuing to work on, to me, it's really touching. Sometimes when you're working in our own little centers, we kind of forget that we're not alone. So in a moment like that, it was one of the things that helped me get through it is the fact that I knew that I wasn't alone in this fight and that people were going to be there with me to be able to keep pushing the issue forward. So big miigwech really to the Friendship Center and the Friendship Center movement, and for continuing to have this moment where we can come and talk about this issue, because it's something that, to me, I could see is something we need to keep working on. We had recently even another event in Joliette with health professionals behaving inappropriately with the Natsgamek women who went for services at a CLSC here. So we could see that it's an issue that we're going to have to keep working on. We were really shocked to be able to have this happen just a few months after the events that unfoiled, and it was workers that were trained actually, where they had some sensitivity training. So we could see that our work needs to continue and needs to go beyond just doing some sensitization and thinking we can close the book on it and keep moving on, because it's ingrained systemically within our network, and that's something that's going to take a lot of work. It's going to take more than just a visibility on the issue, but to concretely look at the systems in place and how it supports this kinds of discrimination. And one of the ways that we can keep fighting it is by having events like this, by working within our networks and sharing what we learn from different places. And it's wonderful to see all the work that's happening across the country and all the different provinces and cities and friendship centers. And for me, it's a proud moment to be able to say that, like, I was a friendship center brat in Montreal, and to be a part of this is, to me, is touching. Some of the work that we've been continuing to do on the issue is developing our clinic here, the Mirerimowin clinic that we put in place not long after the events that happened last fall. We've been working in collaboration with the CIS here, which is the health network. That's the provincial health network here in Joliette in Lanaudiére region. We've been having recently now a nurse that comes once a week to work within our clinic full time. So that's a big development for us. And one of the ways that it helps contribute to it's a pivotal role, in fact, in the center. And we've seen how it's been ameliorating our services for our members by having her included in the intervention team. Because as we've been developing the clinic, we've been trying to make sure that we take a holistic approach when we're intervening with the members or when the members come for services, and look at it more as a global health issue based on the concepts of the medicine wheel, to make sure that we're looking at more than just a specific health issue, but also seeing what other things can be contributing to the health outcomes of the person, and also how we can improve maybe the quality of life for the family as a whole, which is exciting in the development of this clinic. So that's some of the biggest developments. We also have a new table because we were using previously at the last one, the last seminar, we've been using a massage table, which was a little bit insecure. So we have a donation that was given by a foundation here in the region, where we have an actual medical clinic table, which is nice. And I keep the stick that we had the paper roll on in the back here, so I can remind us where we started in the clinic. And it's been, so slowly we've been putting it into place, because when we started the clinic, it was really in response to the urgent need of the community members who, because of the events, have contributed to an even bigger distrust of the system. And when Indigenous people have a mistrust of the system, they're just not going to go to their appointments, they're not going to go to their follow-up appointments, and which will contribute to poorer health outcomes for the individuals. And when we put it into place, it was really as an emergency. We know that we needed to respond to the needs of the community. We had a doctor that was willing to contribute his time to the clinic. And throughout that time, now we have medical doctors that come twice a month to the clinic. They work really closely with our intervention team to be able to look at different solutions to different problems someone has. So if we have an individual that might come in with a certain health issue, but it's revealed that maybe the woman is living some issues of conjugal violence, then we can transfer it over to the team who can continue to support the individual across maybe a process of looking at the relationship, looking how we can get her into a safe space, or if we have children who come in with other physical ailments, maybe a skin rash, but we notice maybe there's an issue with language development, so we can go and help get other services through Jordan's principles to support the individual. And it's something that's been an interesting part of the work, because we've been developing it as we're going along, on how we can make sure that we include our culture across that. So giving the team teachings on the medicine wheel to make sure that we're always taking it from a perspective that's based in our culture and taking it from a holistic approach. And we've had actually no free spaces left in our clinic every time that we have one. So we can see that there's a need for this kind of service in the region, that it's the more that we develop it, the more spaces we can have available, the more time we can have, the quicker it fills up. So I think that the fact that it's within a center where the people can come in, they can feel comfortable for being who they are, they know that they're supported, that they know they're not being judged, is the first step towards them being able to go and take care of anything that they need to be able to take care of, to be able to improve their health, to be able to improve their living conditions. It's just a door that opens that afterwards we can help accompany them towards services that they might need that we won't be able to give here, because we're never going to be able to have a hospital within the center's walls. We won't be giving x-rays. We're not going to be, you know, having operations in the center. But what we can do is make sure that the people feel safe, they don't feel judged, that they feel welcome when they come into the doors here. We do still have quite a few different barriers that we have in place. Like I said, there was another incident where there was a woman who presented herself at the CLSC and then had comments like that she really felt were racist, and the nurses had asked her to sing a song in her language. She felt that they hid her phone. And they made a reference to Joyce while she was trying to seek care. So we know that there's still a lot of barriers to accessibility, and that one experience would make that person reticent afterwards to keep going for healthcare. And one of the issues too that came up is that she didn't want to make a complaint, an official complaint. So whether or not you have an access to a space to be able to make a complaint, whether the individual is actually going to have the courage to go up and make that complaint, that's where there's a lot of barriers to be able to denounce these injustices that people are living. And it happened to be that the woman was the sister of the chief of the community Nanwan that's not far from here. So we can see that regardless of what your status is, who your family members are, nobody is sheltered as an Indigenous person from these kinds of experiences. And we need to be able to make sure that the response to these kinds of events are very severe. And one of the things that I think was interesting to see was that the CIS moved to fire these two nurses immediately. For me, it was an adequate response for the gravity of the situation. And we need to be able to make sure that it's taken as seriously as can possibly be taken, to be able to give the message that this is inappropriate. One of the things that we also need is for other healthcare workers within the system to start denouncing their colleagues too on these. Because we have oftentimes those people have been sitting there listening to their colleagues say denigrating things about Indigenous people, and they let that slide. And that contributes to, you know, the issues that Indigenous people face with accessibility of care. We've also have the government who is not willing to recognize systemic racism within the healthcare network. And oftentimes they bring it up as semantics, that they don't want to, as a reason why they don't want to recognize it. But to me, it seems evident that if we want to be able to treat an issue, we need to be able to name it what it is. It's one of the reasons why we call cancer cancer, and we don't call it a cold. You don't treat cancer the same way you treat a cold. So we need to be able to treat it as it is, as a cancer that needs to be excised from our system. And we need to be able to have the government that recognizes that. Because before we can actually make the changes to create safe spaces for Indigenous people or any marginalized group, you need to be able to admit that they have a problem. So those are some of the things that we're still trying to work on, and trying to make sure that we have people, first of all, that yes, are sensitized to this, that we have a system that's able to react in consequence to the actions that are happening within its network. There's been also put in place here an Indigenous ombudsman position that's going to be opening up at the CIS, which to me, I think is great progress. They've also put in place a director assistant directors, Indigenous assistant directors position at the hospital here, which is also important because we need to have more people, more Indigenous people in positions of leadership to be able to actually put in place changes within the system. So we need to have spaces where we can have access to these kinds of decision making that's happening in these huge organizations. And then we can have a space where a member of the community who feels she's been discriminated against might be able to go and speak up and feel safe that she won't be punished for making a complaint, because that was one of the reasons why it's a reason why a lot of Indigenous people do not want to come and speak out and to make a complaint when they've received that kind of treatment, is that they're worried that their life-saving treatment might be compromised if they do speak out. So those are all different ways that we can keep working towards making sure that these spaces are safe, and including investing into different holistic clinics within the community. If the Indigenous community is saying this is something we need, then the government needs to be there to step up and support them. We like I said, we've really just been trying to do what we can and using the service, different, boring services, a nurse from the CIS foundation that donates us some stuff. But if we had a way that we had the resources to be able to put in place something that is more stable, more from our center where we can control it, it would be a great help to be able to respond to the needs of the community. Miigwech.
Jennifer, just amazing to hear your efforts. Always say never. You said you wouldn't have x-ray or an operating room, but I guess what I hear is just how important social accountability is in trust relationships, right? Like I'm very interested in that. So the challenge being then in hospitals where there is no social accountability, but friendship centers, your friendship center already having those networks and relationships, and then a social accountability to community. So I'm not surprised that your clinic is full. Lots of barriers still, but amazing all the things that have happened then, that you do have an Indigenous ombudsman, you've managed to get an assistant director there in the hospital. And then of course, this idea that just simple sensitivity training doesn't work on its own. So we need these system level solutions. So we need to continue to fight to have systemic racism recognized, because it's only through a whole of hospital, whole of system strategy we'll be able to address it. So thank you for that. Another question here, and I'm hoping maybe the next panelist, Leslie Varley, will help us with it. So Lori Harding, hello Lori, she's asking about the adequacy of funding for the NAFC and the BC Association of Friendship Centers. She said she's been doing some research and she was just shocked at how inadequate it is. Yeah, we say, well, I'm a road allowance half-breed. So one time I said I'd run my medical clinic out of a phone booth if I had to. But yes, we're really adept at doing a lot with little. But I wonder, Leslie, if you had time to comment. But just before that, again, very lucky that I've had the opportunity to cross paths with Leslie Varley. She is currently the executive director of the British Columbia Association of Aboriginal Friendship Centers, the BCAAFC. And that is an umbrella agency supporting 25 friendship centers. She's a member of the Killer Whale Clan, and the Nisga'a Nation is a committed social justice advocate. When I met her, she was in her 9 years holding the Indigenous health portfolio for the Provincial Health Service Authority. And that's where she led the development of the amazing Sanyas Indigenous Cultural Safety program, which is a cutting-edge decolonizing anti-Indigenous racism training program offered to health, social, and justice sectors in Canada. So Leslie's community work focuses on ending racism and violence against Indigenous people, particularly towards women and girls. And she is a proud board member of City Central Foundation. She holds an MBA from Simon Fraser and currently resides as a guest at Musqueam Nation in Vancouver. So Leslie, I will turn the Zoom over to you.
Thank you, Janet. Hi, everybody. It's still morning here in Vancouver at beautiful Musqueam Nation. So good morning. I'm going to first post on the chat line there a link to the Safe Space app and a little news article that we posted about it so that you can have a look at that and check it out while I'm talking. So Safe Space is an app developed by one of our Indigenous medical superheroes like Janet. This was developed by Dr. Alika Lafontaine, and he is now the head of the Canadian Medical Association. So let's just take a moment and pause there and think about that. We have an Indigenous doctor heading up the Canadian Medical Association. So, I mean, that's amazing. And if we can push for anti-racism in healthcare, there is no better person or place to do that than right now. So let's all start, as Elder Jerry Ullman says to us, let's all start making some noise. I do want to acknowledge some of the people who I see have joined us here from BC who were strong collaborators with us in developing that Sanyas Indigenous Cultural Safety Training, which was really decolonizing anti-racism training and was cutting edge in its time. And obviously 10, 15 years later, we see another rash of racism happening against Indigenous people across the country. And we know that that kind of training isn't enough. It's not enough to train medical professionals to look at their biases, to know what racism is. We have to be able to do more. We have to be able to collect the data, and we have to be able to hire and fire people based on racism, which has always been a big dream of mine. And I guess that I gave up and left PHSA because that was never going to happen. So let me tell you about the Safe Space app. What is it? Safe Space is an app that we can download onto our phones, and we're piloting it here in BC. It was developed by Dr. Alika Lafontaine, as I said, and let me just tell you a little bit about him. He, of course, is the president of the Canadian Medical Association. He's an Alberta-based anesthesiologist. He is Anishinaabe, Cree, Métis, and Pacific Islander. And with his brother Kamea, they created this app based on his and his family's and other Indigenous doctors' experiences of racism in the healthcare sector. So as you heard, even the most respected health professionals who are Indigenous experience racism in the health sector. There's no special treatment for them in that regard. So this is a pilot of an app that they have developed, and currently it's housed at BC Association of Aboriginal Friendship Centers at our website. The intention for this app is to go nationwide, and I know that Dr. Lafontaine is working with Jocelyn to move the app into on a national scale. So we have the honor of piloting that app right now. So it was created in 2019. It just coincided with that report about racism in healthcare in BC that came out about the drinking game. Healthcare professionals guessing how drunk we are when we show up, and sometimes we show up with heart problems or diabetes, or we're staggering out of dizziness. Complete teetotaler, and we can still be asked that question, how much have you had to drink? So he developed this as a social enterprise, and it is a learning platform, but the strength of this app is that it takes patient advocacy and patient statistics of racism out of the healthcare system. So far in Canada, the healthcare system has controlled all of the data that we receive on racism. So any complaint about the healthcare system controls that information. And they don't tell us, hey, you know what? BC Children's Hospital is a hotspot for racism in the emergency department. Hey, you know what? The neonatal unit at BC Women's Hospital is a racism hotspot for Indigenous people. They don't tell us that. So the Safe Space app enables us to look at those patterns of where racism exists. So how it works is that you can download the app on your phone eventually. Right now, you have to go to our website, and you can make a report on your racism experience. And the app gathers that information and it lets you know who else is making reports, not who specifically, because this is anonymous. Your safety, your anonymity, it's a hard word for me to say, is completely guaranteed here. So, but you can see that other people are making reports about racism in the healthcare system. And you can look at that and see what's happening. And it's so what it does, the most important thing that it does is it provides external accountability back to the healthcare system and says, hey, look at this. We see some pockets of racism in your emergency room departments in every hospital in BC or in Canada, for example. And so it can hold that data up to the healthcare system. And then we can ask the healthcare system, what are you going to do about that? How are you going to address this racism? We clearly see racism. How are we going to address it? So it can help complement the healthcare system. If they are really willing to address racism and to change, we can work with them externally to provide that information to them and let others see that information and let the media and the public see, you know, where we know that racism exists. We can pick out the patterns of racism around the country and where they exist. Through the SANYAS program, we know, for example, that every hospital emergency room is a racism hotspot for Indigenous people. And so we know that, but the healthcare system doesn't tell us that. They would rather protect that information and risk manage those issues. So in BC, when you make a complaint into a healthcare system, you become one individual making one complaint, and then you don't actually work with the system. It just comes back to you later. You're not a player, you're not involved, you're just the person who's made the complaint, and it later comes back to you and tells you whether or not your complaint was legitimate or not, and whether they're going to do something about it. This app makes sure that you can walk alongside your complaint and see if anybody else is making any complaints. It doesn't provide you with an answer to your complaint. It just lets you see that, okay, so I've made this complaint and 15 other people have made this complaint about this healthcare system. So that's how the Safe Space app can work. Let me tell you a little bit about some of the information that we've got so far, because this app has been open since January. So we've had 3,600 visits to the app so far since we started promoting it in January. 86% of the people who report are reporting themselves. So you can report your own racism experience. You can report a historical experience. If you've witnessed somebody experiencing racism, you can report that you've witnessed somebody experiencing racism in the healthcare system. So 14% of those reports that we've seen so far are on behalf of someone else. So if my father goes into the healthcare system and he has a racist experience, I can report on his behalf as well. So where are the racism reports happening? 56% of those so far, of that 3,600, are happening in hospitals. 16% are happening in long-term care. 10% are happening in community clinics. And the rest are happening in community health services, in pharmacies, in virtual care, among others. The majority of these reports that are being reported are not historical. The majority of them have happened in the past 3 months. However, there is one that's an old report from 2004 that was recently reported. We asked one of the data can ask a lot and pull out a lot of information. So people who are sharing it for the first time, 17% said that they have shared that information that they're reporting with a health region or with a health with a doctor or with a health authority. 61% have never shared that racism report before with anybody in the health sector. 5%, only 5% of us report these to regulators. Out of these 3,600 complaints, only 5% of us have reported this to a regulator. So that could be to a health authority, to the ombudsman, etc. 17% have never shared their racism report with anyone before. They've just reported it online. You can report good experiences too. So we have 91% of these are reporting bad experiences, and 5% of these are reporting good experiences. We asked who is involved. So 47% say it was a doctor, 46% say it was nurses, 34% say it was non-clinical hospital staff, and 34% say it was administrators, and then 22% say it was other patients. So that's really interesting. Another question that we ask here is, are you pursuing the medical legal route? Are you making a formal complaint into the health authority and pursuing it that way? 54% say no. And 15% are pursuing compensation, and the rest are unsure. So those are some of the things that this Safe Space app can do. There's other questions as well. Do you still receive care from these providers? 51% said that they found different care to a different provider to receive care from. 21% said they are still at risk for receiving care. So sometimes in many of our small communities, you don't have a choice of who you get to see. You only get to see one service provider. And so if you've had a really bad experience with them, you're going to have to go back to them. And that's a real fear for us, is that fear of being cut off our services if we make a complaint, which makes the Safe Space app much safer, because we can make those complaints anonymously and they don't go back to the healthcare provider. And so you're not at risk of losing your services if you're making a complaint on this Safe Space app. One of the other questions that we ask in the app is, would you avoid this location in the future? And 80% said they would never go back to those locations if they were given a choice. So this is the very beginning. As I said, it was started in late 2019 with Dr. Alika and his brother, and based on their own experiences of racism. And this is, you know, since January, we've had 3,600 people make complaints in BC. So there's a lot for us to do here. There's, you know, there's an amazing opportunity for us to collectively use and support this app and hold the healthcare system responsible for racism from our own external perspective. Thanks very much, everybody.
Leslie, what an amazing initiative. There's so much to be gained when we kind of take charge of things, our own health services, our own reporting mechanisms. Clearly, it's going to be essential in addressing anti-Indigenous racism at the system level, to hold on to our own complaint system, to have Indigenous ombudsmen. The chat was going a bit crazy, Leslie, because people are pretty excited. They want this Safe Spaces app right away. They want to make sure it's capturing other forms of discrimination. So I see Jocelyn, thank you for helping manage some of that. So it will be coming to your area. It is going to be expanded, but not a surprise, unfortunately. We heard that already from Jennifer about how people don't come back. That's just common sense. And now you've got that data, and we've seen it in some of our health count studies too, high rates of experiencing anti-Indigenous racism and then leading to not coming back into care. So that's awesome. So we've been online for about an hour, time flies, but we do have some exciting new updates, and there's a little wiggle room at the end too if people are getting nervous. But yeah, what we want to hear from next is Stacey House, because she's going to share about an Aboriginal Patient Navigator Program, which in addition to the ombuds person and to getting, you know, Indigenous people in leadership positions at hospitals, starting to manage our own systems of complaints and response, are all part of a system-wide approach. So just Stacy House is a Mi'kmaq woman and executive director of the First Light St. John's Friendship Center, and she's a member of the Maipukuk First Nation. She might correct my pronunciation, and grew up in Conn River. And that is the only recognized First Nations reserve on the island portion of Newfoundland. And it was there she gained her appreciation for something. And she's going to tell us a little bit about that. Sorry, I'm a little drowned in paper, but I'm going to turn it over to Stacy so that we can hear a little bit more. I wonder if someone can help. There was also questions about ombudspersons. Unfortunately, we do not yet have our own Indigenous ombuds people across the country, but there was somebody that wanted to get the name and contact person for the ombudsperson in Quebec. So I wonder if Jennifer can help with that. But now we're going to hear from Stacy.
Thank you. Walalan, thank you for having me here, and Walalan to grandmother Irene for the opening prayer. It was beautiful. Yeah, I'm honored to be here on this panel to talk about racism, systemic racism in healthcare. We see it a lot here in Newfoundland and Labrador, especially in St. John's, because Eastern Health, you know, is the largest health authority, regional health authority here. And a lot of our people have to come here for serious medical services. And so people from small communities such as my own, Mi'kmaq First Nation, and from Labrador, from many rural communities coming here. So even just, you know, coming to the city is a big change and transition. And when you're coming for health concerns, you already are stressed and, you know, worried. And so to enter a healthcare system that you're unfamiliar with, and to hear language and terminology that you don't understand, it can be very intimidating. And so, you know, as like other friendship centers, we provide wraparound services to our community members. And we're structured in 3 departments: business operations, community programs, and social support and housing. And all 3 departments work together to wrap around community members, provide the programs and services that they need and require. And healthcare, health and wellness, and holistic health is a major component across all of 3 departments. And so, for example, if somebody had to come to St. John's to receive medical treatment, we would help them out by providing medical transportation. And that is a social enterprise of ours. And we have contracts with the Indigenous governments. So they would get to the city, we would transport them to their medical appointments. We are just now in the process of opening a boutique inn, which will act as a medical hostel. So then people can stay at an Indigenous owned facility where, you know, it's culturally safe and there's familiar faces. Indigenous people are working in that location as well. And then when they get to the hospital, we have the Aboriginal Patient Navigators. And that is what I want to talk a little bit about today, and just the importance of these types of roles. And as mentioned previously, you know, we need to see Indigenous people in all positions and all positions of leadership, and that is so important. And so to be able to have Aboriginal patient navigators in the hospital setting when people are coming to the city to receive medical treatment, it is so valuable to community members. And so the Aboriginal patient navigators will help translate if they need it, attend appointments. They will, you know, show them where their appointment is taking place. Sometimes it's in different locations and, you know, different parts of the city. So we will provide that transportation, and the Aboriginal patient navigators will be there as a support to the individuals. And so one of the things that we've also, you know, came as a challenge for us is working with that institution and that structure which exists, because these systems and structures weren't built to support our people. And one of the things that we've struggled with is the policies which exist in the healthcare setting and Eastern Health policies. So we have two Aboriginal patient navigators right now. Both are Inuit, and we were seeing a lot of Innu people come to the city. And so obviously their first language is Inuamun. And so they would need translation and they would need that support. And so we're actually successful in securing funding for a third APN position, Aboriginal Patient Navigator. And that position was to be for someone who was fluent in Inuamun, who understand the culture, understand the community member. And we hired someone, and they were from a small community. There's two Innu communities in Labrador, Shahashik and Natwashish. And, this individual wanted to help their community members, but the policy stated that you were not allowed to help anyone you were related to. And so, of course, if you're from a small Indigenous community, like, you're related to half the people in that community, right? I'm sure many people here understand that, like, my third cousin, my fourth cousin, you're related somewhere along the line. And so that was really difficult for this Aboriginal patient navigator, because she said, I came here to help my people, to help my community members, but you are saying I cannot work with them because we are related and we are family. Well, everyone in my community is my family. And so this was something that we struggled with, and it didn't work out with that individual. And so we took a step back and said, how can we best serve the community? How can the Aboriginal Patient Navigator Program benefit the community members? And so our social supports director and one of our lead APNs actually went to Labrador to do a whole recruitment process with the community members in Shahashi and Natwashish. And they talked about what the job entailed and how they can help the community members. And we tried it again. Same kind of issue happened with the family, with, just a lot of barriers with the policies in Eastern Health. So then the third time we had to take a step back again and say, you know what, this isn't working. These structures, these systems, the Eastern Health policies are not working for the community members. And so what we did then is met with the vice president of Eastern Health, and we talked about how this position did not work the way it was structured, the way it was set up. We needed to change it, and we needed it to work for the Indigenous people. So then we advocated for change so that we can have this third position paid for by Eastern Health, but not follow Eastern Health policies. So as you can imagine, it was a bit challenging to get approval for that, but in the end we did. And so we are going to structure this third position a bit different, and it's going to be more of a cultural support position. And we'll still have our two APNs in the hospital working out of Eastern Health under the policies, but this third position will be cultural support and will help them still navigating healthcare services, but how it will benefit the people. And you can work with your family. Your community is your family. And I think that's so important to understand. So we're really happy about the success of the Aboriginal Patient Navigator Program. We've been working on policy change, and as most people know, like, it's a process for sure. We have a St. John's Indigenous coalition called First Voice, and health and wellness is one of the priority areas. So we would like to, decolonize healthcare policies. And we brought together many different community members, organizations, partners, and all three levels of government to talk about solution to these barriers which exist and which lead to racism in healthcare. Because as many people said and have said before, it goes beyond training. Like, training, it's great. It's a first step to be aware, but it needs to go much, much more beyond training. I just want to talk about a little story. If I just have time, I know we're running out of time, but I don't want to talk too much, and I can talk for a long time. So when Leslie mentioned, about the alcohol and being questioned, like, how much have you been drinking? It reminded me of a story that one of our community members had told. And she was with her uncle who, was from Labrador and had come to the city for healthcare, and he got sick and his condition got worse while he was here. And she went to visit him one day and he was strapped down to the bed, and she asked a nurse, like, why is he strapped down? She's like, oh, well, he was experiencing extreme alcohol withdrawals. And she said, well, he's sober. He hasn't had a drink in over 40 years. There's no way he could have had alcohol withdrawals. And she said, oh no, it was alcohol withdrawals. Only to come to find out later that he had actually had a stroke. And she had just made the assumption that he was going through withdrawal from alcohol. So, I mean, and this was about 10 years ago, and it's still happening, right? It still happens. Of course, we hear stories about it all the time. So I'm really excited for these new initiatives. I'm really excited to hear about the Safe Space app. Data is so important, data collection, these stories, to talk about it more. Events such as this is amazing. So thank you all for having me, and I look forward to more conversations. Wow.
And Escomatin, Stacy, yeah, I'm sorry I didn't have my pages in order when I was doing your intro. You actually had an appreciation for youth culture and community, and it sure comes through. And then I was so impressed to read that you did a bachelor's of art with a major in psychology, minor in Aboriginal studies while volunteering. And then you've had 14 years of work at First Light, and now you have an MBA, and you're also a mother to 2 boys and a member of Eastern Owl, a locally and nationally known group of women who blend styles of First Nations drum music and contemporary folk. So I must just say I'm in amazing company, and I feel so inspired, even though we're talking about these tragic things. Yeah, that thing about thank you for sharing the story, even though it looks like we're running out of time, but we're going to have enough time, right? But that idea, I was actually invited to participate at the inquest for Mary Johnny up on the other side of the country, and at the request of her mom. And yeah, she had been mistreated as alcohol withdrawal when she was dying from other multi-organ problems. So yeah, what a horrible story. And we hear them all the time, and we want to record them and remember them. But in a lot of stuff going on in the chat here. So yeah, people just really holding up their hands for your great work, Stacy, and talking about like how, because again, you had to make 3 positions out of 2, right? And clearly, and work with others to hear about what the needs are and customize those positions, but just the idea about how we need them in small urban settings as well as the larger urban. So thanks for that. So we have, it's an ambitious thing to have 6 speakers in 90 minutes, but we're getting through. So we do have one more new initiative, and then we want to make some time for our final panelist, Lori Mishbin-Jima, who's going to actually explain some legal options. But before that, we're very lucky to have Michelle Cuvelier. And I just want to say how impressed I am too by this panel, not only because there's these amazing people doing amazing work, but they're from all across the country. And Michelle's based out of Halifax, Nova Scotia, and she's a Jordan's principal coordinator at the Micmac Native Friendship Center, and she's been with that organization for 2 years, and she's an expert on Jordan's principle and working on advancing substantive equity for Indigenous children and youth. And before that, she worked in addictions-led child treatment and recovery center and as an addictions counselor. So Michelle, I will give you the Zoom floor.
Well, I'm really excited to be here today. I feel like what a great opportunity. I am extremely passionate about Jordan's principle and where it's moving and some of the challenges and things that we need to look at. So I did do a PowerPoint. It is a little wordy, but I am going to tell you that I will pretty much fly through it, but you guys will have it as a, so I'm going to share the screen now. Can everybody see that?
Yeah, I can see it. It's yeah.
Okay.
You want to maybe push slideshow and we'll just see the one slide versus we can see the one slide and then the other slides on the side.
Is that working okay?
Yeah, it's all good the way we can see it. Yeah, there you go. That's even better.
Okay.
Great work, Michelle.
Perfect, thank you. I want to first start by always honoring the memory of Jordan River Anderson. I think it's extremely important. We obtained some of these pictures quite a few years back to be able to share on anything that we do. So I do always like to stop and acknowledge Jordan in every presentation that I do. And we know that Jordan's principal, you know, unfortunately came from somewhere really dark, and we hope that moving forward we can honor him and his family in any presentation we do. So I just want to talk a little bit about Jordan's principle, because there's a lot of myths and a lot of misconceptions about how you're eligible, what the process is, all of those things. So it is currently First Nations and Inuit children that are eligible. We do have a portion where it's self-determination, which has not been made 100% clear what that looks like or how you become eligible for that. We're still in the process of getting confirmed details about that. So what we look at in the beginning of eligibility in the process is to make sure that the family is supported in understanding what their needs are. That being the biggest challenge, because a lot of the time the families have been to the healthcare system, have not been successful, have not received diagnoses, have not had success with family doctors. So by the time they get to us, we're looking for information and they don't have any. So the first step is to really access as many services as we can, which can be really challenging in the healthcare system. I've had doctors tell me that they are not going to write me letters of recommendation. I've had healthcare professionals tell me they don't know what Jordan's principle is. They don't feel that it's real, that they're not going to document the person's, you know, information. Then we have to go through the hospital and Capitol Health to get the records released. So with Jordan's principle, the first thing we have to do is identify the need and then have documentation to support that need to send it in for a funding application. When we can't get the documentation, or a doctor's visit, or a visit at Emerge where somebody will give you the documentation, it holds up that process. And that can be really frustrating, because Jordan's principle is there to kind of fund those gaps in services. The problem, the challenge is, if we don't have documentation, we have a struggle about how we're gonna apply. They say that that's not the case, but a lot of the time that is the case. So if we don't have a healthcare professional, an academic professional, somebody who relates to the need of the child, then we get stuck in a queue, and that application will sit there for quite some time before we seek out the appropriate person to write the documentation. Once we get that documentation, what happens is adjudication or escalation. Adjudication means that the file has been deemed eligible in that province to be determined there. Escalation means it has to move up to Ottawa and it has to be reviewed by a panel. In the case of 48 hours to 12 hours, what that means is in 48 hours, we're supposed to have an answer to a non-emergent case. In 12 hours, we would need an answer to an emergent case. That is not always the case. I know they strive really hard to make that happen, but there's been a lot of times where that just isn't happening. So we do struggle with that within our region. I can't speak for all throughout Canada, but I know that I've talked to a lot of other Jordan's Principle coordinators that struggle with some of the same things, delays in decision-making, not having service providers, not having culturally appropriate service providers to send people to. So we kind of get stuck in this wheel of waiting and trying to find the appropriate professional. I may have a child that needs an autism assessment, and the parent is not willing to go to the services that are available because they feel that they're not culturally appropriate. So we've been working really hard to obtain those services through the Friendship Center because we have a lot of wraparound services. So we've been trying to fill those gaps within a Friendship Center program, but we're not 100% there yet. We hope to be there eventually, but we're not there yet. So that would be your adjudication and escalation. Your verdict is whether you're approved or you have to go into a denial. In saying that, one of the biggest struggles is we may wait weeks for an approval. Once we get the approval, the family may have accessed something different, or the need may have changed, and then we have to start again. We do have really good interactions with what we call our focal points. So that's the person who adjudicates the application. And then what we do is we try to discuss whether it's an emergent case and how long it's going to take to turn emergent. That changes based on every request. So I can't necessarily say that, you know, one is different than the other, because my experience has been, it's been different timeframes all throughout. So that has been a struggle for a lot of families to understand when the literature doesn't match what the actual process that's taking place. So that can be really frustrating. We do support our families through denials, and we make sure that we can come up with as much documentation to support them to get the services that they need. Denials are not they're not, what's the word I'm thinking of? They're not presented in a way that's understood. So you get a denial letter, what happens is the parent doesn't understand the denial letter. And when we try to explain it, they get very frustrated, because the most that you're going to see on a denial is it doesn't meet normative standard. Normative standard is what the province has in place as a normative standard of care. Well, we know that normative standard of care isn't working for communities. So trying to explain that turns into substantive equality. Substantive equality is something that takes place when we get denied a service or the service is above normative standard. An example of that would be respite. So in the system, we may have kids with multiple medical needs, and they may need respite. If they don't meet the province's IQ or diagnosis to meet that respite standard, they would come to us. But for example, they won't use behavior opposed to diagnosis. We know that there is a ton of behaviors that may need to be supported by respite, but then we have to go back and look at multiple different avenues to support that with documentation again. And it becomes a struggle to find that if they have not had any medical care during a long period of their lives. So it's just kind of a holdup because of that interaction with the healthcare. People are not reaching out to the system. They don't have family doctors, or they refuse to access any of the health systems that are in place. So we have a lot of people that don't have that documentation and can't get it because they haven't been following any medical professional with their kids or with themselves, which, you know, is really a struggle for those families. I work with off reserve and on reserve, but primarily off reserve. And the process itself is the same for Jordan's Principle on and off reserve. The difference lies where the family support systems are. So off reserve, you may have more supports to access than on reserve, but a lot of those supports the families are refusing to utilize. So that can be really problematic. And sometimes we do have First Nations specific programs, but then we have wait lists because our numbers are climbing so fast that it's hard to keep up without creating, you know, major blocks in the people that we do have and overutilizing them. So we are seeing a lot of things that we're struggling with there. So that's kind of the context there. The biggest challenges that we're facing the whole way through is gathering supportive documentation. If I don't have it, I can't apply. You are no longer eligible without that documentation. And there are times where we'll call in and say, well, we're going to get this documentation, and sometimes that'll be enough, but we have to comply with it at some point. Education, community organizations, and institutions don't know what Jordan's Principle is. There's a lack of information in the systems. I've talked to, I don't know how many doctors, how many educational professionals. I've talked at school board meetings. I've kind of made myself as public as I can be. And still, I have people saying, I have no idea what you're talking about, and I'm just not writing a letter for that. So the struggle is constantly there. Also, the varied awareness of the implementation of Bill C-92, the lack of culturally safe, competent services, all of these are challenges. We may be able to get the money for somebody to access services through Jordan's Principle. It does not mean that there are services available that the family is willing to utilize. And that's the struggle that we have in the biggest way. The money may be there, but the cultural appropriateness and safety that they're looking for isn't. So they could have the money sitting there for a full year and never use it, just based on the fact that we are unable to find something that they're comfortable accessing. So that can be really challenging. We do see impacts in a lot of different ways, and I like to talk about that because we see some great impacts with Jordan's Principle, and we've seen some fantastic movement within the systems, but there is still a struggle. 100% a struggle to make Jordan's Principle accessible for a lot of people. We do see a lot of promise, and I think there's a lot of questions being asked now where we can, you know, kind of say, hey, these are our challenging points. What are we going to do about them? And I do feel like those conversations are taking place. So I'm excited about that. I do kind of like to share this story because I think it's really relevant. The Friendship Center, when I first started working here, one of the biggest problems I had was that I could not find culturally appropriate services. So I had all these families that were coming looking for help, and I was getting approved for all these applications, and then they were turning down every option of service that I would give them. So I have a lovely executive director, Pam Glode, who was like, what are these services? Tell me what they are, and let's look at creating them within the Friendship Center. So we now have created a cultural mentoring program. We have a respite program. We have a structured respite program. We have a family navigation program that helps you get through all of the services, health services, social services. We also have supervised access. So if the children are involved in DCS, we're going to be the people that are writing the recommendations to the court, opposed to it being through community services. We also built in a supervised access and family visiting area here so that all the DCS cases could be managed within community, opposed to having to use an outside organization. So we're adding to that list all the time and creating those gaps in services that haven't been addressed yet. So they're not all addressed, but we are definitely working towards making them accessible from a wraparound perspective within the community and within the Friendship Center. So we're really excited for where we are right now, but we do recognize the struggle that we have in the healthcare system, and just being able to access a conversation sometimes is a struggle. You know, I've been trying to get a hold of one doctor for 6 months for a child who has leukemia, and he hasn't returned a single phone call about the things that I need to document that this child may benefit from. So, you know, we're persistent. We keep coming to try to have those conversations, and we will continue to do so. And the hope is that moving forward that we see progress in those areas, and that the Friendship Center is hopefully one day able to fill all those gaps in services so that we can have kind of our own health related answers to those questions. So that's currently where we are. Yeah. So thank you so much for having me, and I will answer some of the questions. I see them coming up, but I will get to them.
Yeah, thanks so much, Michelle. And thanks for going through things a little bit more quickly. I didn't do a very good job of time management. I'm not sure if they're going to hire me back again as an MC. I'm sure glad you're there, though. It's very interesting to me. First of all, thank you for showing the pictures of Jordan River Anderson. I hadn't seen that many pictures, and often I think about Jordan, and so I appreciated that. I'm glad that you're there. Very interesting, right? Like how when like non-Indigenous government organization invents something, then we need a whole bunch of people to help do the interface. But I'm so glad that you're passionate in getting people those services. And I love the story about then the Friendship Centers just providing the services. One of the things I was thinking about is maybe we got to get Alika and Indigenous physicians on the phone and just find a whole network of Indigenous physicians and allies that would volunteer their time to do those applications. So amazing. Yeah, something for us to think about. So yeah, there was no way to contain all this awesomeness. We have one more speaker. I'm looking for some advice from Jocelyn. Laurie Mishpanjima is actually a colleague of mine at the University of Toronto and Anishinaabe from Wikwimikong. We really did want to have her share some information today, like about what the legal options are when experiencing discrimination and barriers and access to justice. And she's an amazing person. She's worked as legal counsel to Human Rights Legal Support Center for 10 years and also done a whole bunch of work in our community. Now, I wonder, Jocelyn, what would you advise us? Should we have Laurie? Let's hear from Laurie. Important words. Okay, so Laurie, just awesome to see you today on this panel. I don't think our paths have crossed a whole bunch here in Toronto, but just amazed to see that how lucky we are to now have you working at the Indigenous initiatives at Osgoode Law School at U of T. And yes, please, let's hear from you a little bit about what our rights are and help people on the panel understand their rights.
Ani Bojo. My name is Laurie Mishibanijma, and actually Osgoode Hall Law School is at York University. So we are not colleagues, sorry.
I stand corrected.
You.
Okay, thank you. I'm running a vaccine clinic at NAMIRES, but yeah, maybe
I am on the board there, so that's
yeah,
how
okay,
that's how we're
okay.
colleagues.
There we go. Thank you. I looked it up and it said Osgoode Hall at U of T. So anyways, I'll be quiet now. But thank you for the correction.
I did have a PowerPoint. I don't know if that is going to be.
Yeah, let's put up your PowerPoint. I've got my my marching orders from Jocelyn are that we're going to hear from you because this is really important. So I understand some people might have to leave, but we're going to go on till 2:45 so that we can give you your 12 minutes and then have a close from Grandma Irene.
Great. So who's responsible for putting my PowerPoint up? Is it me?
I'm looking. Does anybody want to jump on and direct us on how we can get Laurie's PowerPoint up?
Okay, so I share my screen.
Yeah, do you know how to do that, Laurie?
Yes, hold on.
Okay.
There we go. All right. Can everyone see my PowerPoint?
Yeah, it's looking really good, Laurie, and thanks for your patience.
Great. So what I wanted to talk about today was to explain what discrimination is, but I think that all of the other panelists have done a really good job with that, so I will skip that portion. But so mostly I'll focus on what are your legal options when you experience discrimination in healthcare and which option is best for you. So, sorry. Oh, sorry. So the first thing we'll discuss is choice of forum. So first thing I want to let you know is that this is not legal advice. I am sharing legal information with you. For questions about your specific case, I suggest that you seek independent legal advice in your local area. And the first thing that we also have to address when talking about the Canadian justice system is that Indigenous people have experienced many barriers, and the justice system in Canada is not built on Indigenous values or Indigenous law. In fact, it has completely disrespected and disregarded Indigenous laws and Indigenous values. So it's really hard for Indigenous people to relate to the Canadian justice system for these reasons. Also, colonization, genocide have created a massive distrust. You all know this. So again, another reason why Canadian justice systems are very difficult for Indigenous people to relate to. And
yeah.
And so given this, and Jocelyn had already said this as well, but what I'm going to talk about are the Canadian justice system processes. And these are just options. They are not the be-all end-all of how to resolve issues. Just because I'm talking about them today doesn't mean that these things are going to work for you or these options are going to work for you. So I'm not here to force these processes on you. I'm just letting you know that these things are available. And actually sometimes maybe settlers respond better to their own justice processes. I say maybe, but for historically 99.9999% of the time, they respond better to their own justice processes. Just like most people would, just like we would respond better to Indigenous justice processes. So choice of forum, when I say forum, I guess what I mean is like the types of Canadian justice processes, so tribunals and courts. Discrimination, you guys have already heard lots of examples of what discrimination is, but basically if you feel like your dignity, equality, and personal individual respect is being diminished in any way, then you may be experiencing discrimination. So there are legal definitions of this, but for the purposes of Indigenous people figuring out whether they experience discrimination, the best thing to do is to assume that what you experienced is discrimination, and if you want to access Canadian justice processes, to talk to a lawyer and to see which forum your scenario might actually get the remedy that you're seeking or what you want to get out of the process. So generally, I have here, you can only choose one forum. Why? How do you know which is the best one? So Canadian law have these rules that basically that say you can't access all of the different processes at the same time for the same story, for the same experience. You can't go and have you know, a human rights claim and a civil claim, because that would be considered double dipping, and Canadian justice processes aren't really into double dipping. So generally, and there are some exceptions, but you can only choose one of the processes. So I'm sorry, I only have, I'm already mostly through my time. Okay, so
take as long as you need, Lori. It's all good. This is good stuff.
This is the next piece is which choice is best for you, because you're only allowed to potentially choose one for the most part. So in the middle here, the red circle, I have kind of what options might be applicable to you if you've experienced discrimination in the healthcare system. So every province has a human rights system or process. So some provinces have a commission style system, which healthcare falls under provincial jurisdiction. So you do want to look at your province. For the most part, occasionally it might be federal, but it's like the rarity that it'll be federal. So you're looking more at the provincial processes. But there are two jurisdictions, BC and Ontario, that have a direct access system for the human rights process. So that is one option. And then you also have the ombudsman. So the ombudsman can be either through the hospital, so the hospital ombudsman, or it can actually be through the province. So some provinces have their ombuds, like healthcare under their provincial ombudsman process. And some, like Ontario, have a separate patient ombudsman for healthcare that is outside of the hospital. So that's another option. The next is professional regulation. So this is your doctor and nurse, for the most part. They are both professionally regulated, and they have colleges. So those colleges have complaints processes. And then the next process, which might be applicable to you, is a civil proceeding. So this is in the provincial court system. And then lastly, and I don't view this as lastly, obviously, I'm from Wiki, I'm Indigenous, I'm Anishinaabe, and I try to practice Indigenous law as much as I can, but Indigenous dispute resolution is another option. But part of why I have it there at the bottom is that settler justice processes have not recognized Indigenous laws and dispute resolution. Maybe they're starting to today, but for many years, you know, thousands of years, our laws and processes have been completely disregarded, not acknowledged, and disrespected. So I don't want to include it as a part of settler justice processes, but it is an option that is available if you have willing parties, basically. So the next important part is this gray square that says facts, limitation period, jurisdiction, remedy, costs. So these are all legal terms that, you know, I do this training in like a day normally, not 12 minutes, but these are all things that lawyers would know the answer to. And it's pretty much not fair or impossible to expect the average person to know the answers to these questions and which one best suits them. So, you know, whether facts would fit well with either human rights or professional regulation or civil proceedings. What the limitation periods are for all of these processes are all different. Jurisdiction is another issue if you are on reserve, especially. And then remedy is like the thing that you want to get out of the process. Do you want money? Do you want what process do you want resolved? Do you want some certain element of your healthcare to be upheld? Do you want the doctor to get in trouble? Those are your like remedies, like what you want to get out of the process. And then the other thing to consider is potentially costs of leading the process, like doing it, actually going through the process, but then potentially costs if you are not successful. The courts sometimes do award costs against a party, against an unsuccessful party. So these are all complex issues that lawyers even, you know, think hard about. So again, the average person is not expected to know or to be able to reflect on and analyze all these complex layers and then to decide which in the red circle is the best. So generally, human rights, it's like lower costs, lower financial remedies than, for example, civil proceeding. But human rights is free and civil proceedings are not. Ombudsman, generally you're looking at not financial remedies, but individual remedies with the particular hospital or healthcare provider. Like they didn't answer your call, the ombudsman might make that healthcare provider answer your call. Professional regulation, this is generally in relation to discipline of a doctor or a nurse, but you don't get financial remedies. So if that's what you're seeking, you won't be able to access that in a professional regulation process. And then Indigenous dispute resolution is like so creative and open. You can try to negotiate any type of remedy, but again, all of the parties have to agree to this type of process, and the doctors, nurses, hospitals might not agree because they don't understand, they don't respect, they don't acknowledge Indigenous law. So there are pros and cons to all of these processes. And again, you might only be able to choose one. So you have to talk to a lawyer before you decide which one you choose. And you have to do that immediately because some of these limitation periods are 6 months. Some of them are a year, some of them are 2 years, some of them are 15 years. The ones where it's 15 years, that's civil proceedings, and that's where you have to pay more money to participate in that process. So at the end of the day, do these processes support access to justice for Indigenous peoples? No, absolutely not. And you've heard all of the reasons why from the other panelists. So what do we do? The panelists have already explained all of these barriers to you. I'm over my time, I'm really sorry. But one of the key things that I want to say as something to resolve some of this, first of all, thank you to all of the panelists for all of your hard work. You completely contribute to the health and well-being of our community and nations and the effective use of resources before these issues have to go to a legal process. So that your work is super important, and you've been working on addressing all of these barriers, which again is super important work. But some of the things that we have to do to resolve some of these barriers in relation to legal processes are we need people Indigenous people in places of leadership. We need research, design, and empowerment, acknowledgement of Indigenous justice systems, respect for Indigenous laws, and accommodations and Indigenous decision makers and accountability processes, like to services like hospitals, doctors, nurses, healthcare providers, as well as government for providing resources to help address these barriers. Accessibility at tribunals and courts, supporting access of Indigenous people through including Indigenous law processes, mediation processes. You see that in little ways where people can, bring an eagle feather to a justice process, or having a smudge or an elder lead the process. So it happens in small ways, but doing this on a larger level. And as well, one of the key ways that you can create accessibility in the justice system, the barriers are very similar to that of the health system, is to have a trusted intermediary. That's a hard word for me to say as well. But that means like people at the friendship centers, people at Indigenous health centers, Jordan's principal navigators, patient navigators, all of those people are incredibly important in sharing this and having a knowledge of what options are available to their clients, and then sharing that and helping them through the process because they just trust it so much. So like, it sounds horrible, but like standing by their side and like being there 100% for that Indigenous person trying to break through all these barriers. You need the support of your community. And so, like I said, trusted intermediaries are probably one of the most important ways that we can change justice processes at the beginning, at the start. It's going to be difficult to change systemic things right now. And this is one way that we can start. Thank you.
Laurie, it's always tough to be at the end of a panel, but that information was so valuable. It's overwhelming to me. I used to envy the law students a little bit when I was in medical school because it looked like they could have more free-ranging discussions, but I thought, well, at the end of it, they're stuck in a system and maybe I have a little bit more wiggle room. But I learned a lot. I'm going to recommend that we bring you back and maybe even have a whole forum dedicated to these issues. So thanks again for your patience, because maybe I could have been a little bit stronger on the timekeeping. This has been just such an amazing 90 minutes. And I have learned a lot, and I'm glad it looks like a lot of people have actually stayed longer. But what I'd like to do is just say thank you to each of the panelists for sharing their wisdom, doing it in a time period of 12 minutes. Thank you to NAFC for organizing this and giving me the opportunity to be MC, and then just turn it right over to Grandmother Irene, who's holding her feather and the smudge to close us out in a good way. I'm going to look forward to participating in the next forum and continuing these conversations. So Grandma Irene, and I think you just have to turn off your mute.
Can you hear me now?
Yeah, I can hear you, Grandma Irene. We
Can
can hear
you hear
you. Yes, we
Okay.
can.
Well, thank you. Well, it was I enjoyed it. And what brought to my mind was when we wake up from the east, we wake up where the eagle sits. It gives us clarity of vision as we travel down towards the west where the bear sits. It gives us that balance. And these are the things that kind of brought to my mind while I was listening to this. And also, then our medicine wheel stands there with the white, red, yellow, and black, the 4 colors of the people of the world. And then the crater is the one that told us everybody is equal. That medicine wheel stands for equality. And these are the things that gets me through sometimes when I hear things happening like that. And I also teach the little ones when something's happening with them. I tell them about the medicine wheel. You'll learn about that, when you get through. But think about it when something's like going, is happening in school or anything. So they kind of feel good when you can tell them that. But they still have an awful lot to learn, awful lot to go through to be that equality type, where you can stand. To me today, I'm there. I feel that I'm equality compared to all of those people, the colors, because I guess because I'm old and I'm ready to go. But it's neat. It's neat to see that kind of teachings to give to the young people, because some of them never heard that. So it gives them a little bit of something to think about, I guess, when things go not too good. Anyway, thank you, Corey, for this day. And it's been a pleasure for me to listen to all these wonderful people with their knowledge and all the things that they need to do for our people. And we ask you, the Creator, to help us do all these things for it's not just for us, but it's mostly because of our little ones, our children. When they're coming up, they need to be a little more on the easy side than we have been. So we need to make them feel better, wanted, the same way as everybody else is. So we ask you, Creator, to be with us today, and ask you to keep our elders safe, our little ones, the ones that are called on midnight, and also our excuse me, and also our sisters in spirit that died in violence, and our people that are dying of AIDS. May you have a loved one. There's a peace on the Creator's kingdom, and there's only love and peace there for them. And we ask you, Creator, to keep us safe in the work that we do, the things that we need to do, and to be brave to do it. Sometimes you need just a little help. You need a little feather in your hand, or a little package of tobacco. It's always nice to put a little bit of tobacco every morning when you go to work, and that guides you through the day. And it reminds you of a lot of things that can happen. And you keep them. Your mind is it's stronger when you do this every day, and it just comes natural after a while. And it's amazing just how good it is that you've done it for so many years, and you find that you're stronger in so many years, where likely you wouldn't have that good feeling, because you put yourself in that spiritual realm where you find you feel safe there and you can work better with it. So let us have a good day today. Have a good day, have a good evening, have a good week.
Thank you, Knina Skomatin, Grandmother Irene, and everybody. I hope you have a wonderful day. Thanks for those that stayed a little longer. And thanks to all of our panelists and those that shared, and all those that asked questions and sat with us today. All my relations, hi.